When you think of oral health, what comes to mind? White straight teeth? Brushing after meals? Regular flossing? All of those things are necessary for good oral health, but it goes much beyond just the basics. By the age of 18, the average adult has 32 teeth, 16 on top and 16 on the bottom. However, the average mouth is made to hold only 28 teeth. These 4 other teeth are third molars, also known as wisdom teeth.
The reason that we have problems with the wisdom teeth is that there's not enough room for them to come in. If there's not enough room for them to come in fully or only partially, then it becomes a problem where we aren't able to keep them properly clean, and that leads to more problems for us, and that's the reason that we usually remove the wisdom teeth.
The extraction of wisdom teeth is necessary when they are prevented from properly erupting within the mouth. They may grow sideways, partially emerge from the gum, and even remain trapped beneath the gum and bone.
Impacted wisdom teeth are just teeth that haven't erupted properly into the mouth. They're stuck behind the second molars. Usually it's an angulation problem, an impedance of the tooth being able to come in properly because it's bumping into the second molar. And that usually sets up a situation whereby that tooth either causes a problem for the second molar, or it leads to a problem where we can have an infection in the wisdom tooth, a cyst around the wisdom tooth, or cavities on either the wisdom tooth or the tooth in front of it. In those cases, we usually want to intercede and remove those wisdom teeth.
Oral surgeon Dr. Alan R. Forfar has been in private practice in oral and maxillofacial surgery since 1993. With an oral examination and x-rays of the mouth, Dr. Forfar can evaluate the position of the wisdom teeth and predict if there may be present or future problems. Studies have shown that early evaluation and treatment result in a superior outcome for the patient.
It was a much better process getting my wisdom teeth pulled than I thought it was going to be. I came in, I did general anesthesia, and I really don't remember anything after that. I remember waking up. So I remember waking up, how are you? How are you feeling? Sit here for a couple minutes, take your time. Somebody was with me and talking to me the whole time. Took me over to the recovery room, made sure I was okay, gave me an ice pack. Just like, here, go on home, have some ice cream, enjoy yourself. Take it easy for the rest of the day.
The ages that children should come in to have an evaluation for the wisdom teeth has changed, I think, over the last 5 years or so, where we're seeing children with fully developed wisdom teeth at the age of 13, 14 years of age. It used to be that we would see them when they were 18, 19, 20 years old, and we would evaluate them. It just seems that kids are developing faster these days, earlier, and we want to get an idea of where those wisdom teeth are at an earlier age.
Another area of dentistry that is helping to maintain good oral health and changing the way people live is dental implants. People who have lost teeth might feel too self-conscious to smile or talk. Additionally, biting irregularities caused by tooth loss can have a negative effect on eating habits. Dental implants are designed to provide a foundation for replacement teeth, which look, feel, and function like natural teeth.
A dental implant is nothing more than a screw-type structure that replaces the root of a tooth, or acts as an anchor for any type of appliance that you want to build in a patient's mouth. We use them for crowns, we use them for removable type appliances, and we found that we can use dental implants on just about any age-type patient.
By replacing missing tooth roots, dental implants provide people with the strength and stability required to eat all the foods they love without struggling to chew. Additionally, dental implants stimulate and maintain jawbone, preventing bone loss and helping to maintain facial features.
We can place dental implants in just about any setting. We can put people to sleep to place them, we can have them awake, we can mildly sedate them. It depends on the patient. The procedure really requires that the area be numb. We open up the tissue, we drill a small hole, we screw the dental implant in, we put some sutures over top, and we're finished. Then we wait approximately 4 to 6 months, and we come back and we start to use that implant.
As a board-certified oral and maxillofacial surgeon, Dr. Forfar manages a wide variety of problems relating to the mouth, teeth, and facial regions at his offices in Schaumburg and Wheaton, Illinois. He will also diagnose and treat facial pain, facial injuries, and TMJ disorders, and performs a full range of dental implant procedures.
I was referred by my general dentist because I needed to have an implant, and when I met with the doctor and his staff, they explained the whole procedure to me, and at first I was very, very nervous about it. I thought it was going to be extremely painful, and I was very pleased with the outcome because it was virtually painless.
Well, we use a number of different technologies to explain implants. What kind of works the best actually is just simply drawing a picture. It seems pretty old-fashioned, but people understand a picture. So if you can draw the picture, they can usually follow along and understand exactly what's going to happen. We have a lot of different movies and models that patients can look at. They're on our website. People look at them before they come in to get an idea of what we're going to do. But everybody likes to have a picture drawn. We usually make a copy and they want to look at it when they leave here to make sure that they understand what's going to happen.
Initially, before I had the dental implant placed, I was very concerned about the final product, the restorative product. And the doctor I had asked him that question, you know, will it feel the same, will it feel different? And he had explained that it may feel a little bit differently when I bite down on it because the implant is in there solid and your teeth have some give and move to them. I have found that I cannot tell a difference at all with my dental implant. It feels just like a regular tooth to me, and I'm thrilled with the outcome.
From wisdom teeth to dental implants, facial injuries to TMJ, Dr. Forfar and his talented staff at Associates for Oral and Maxillofacial Surgery will meet all of your oral surgery needs. To learn more or to make an appointment, call Dr. Forfar's offices today or visit docjawil.org.